You ready, Rachel? All right, everybody. It is 4 o'clock, and we are here today to give an update. Today will be almost entirely on the coronavirus and a little bit on some healthcare decisions that we have made in our future that are now turning out to be even better decisions from a fiscal standpoint for the Commonwealth. But first, at a time when cases are rising, let's remember that we'll get through this, and we'll get through this together. And we're going to get through this because we are seeing really good compliance out there with people willing to do what it takes, knowing right now we're seeing this get out of control in so many other states. So one more time, we'll get through this, and we'll get through this together. So right now what we are seeing is every single day, or just about every day, we have record number of cases across the United States. You put up that graph, James? We know the virus doesn't respect our borders. We know that Kentuckians are traveling all over the country and continue to go to places that are setting all-time records for numbers of cases. We know that the virus will move into Kentucky from outside and will move around different communities. So what's going on in the United States is something we have to pay attention to every day, and this ought to really worry all of us living in this country. We are at war with the coronavirus. It is Americans versus COVID-19, and we better view it that way. All of us together making sure that we can defeat this virus. I used to talk about it a lot, but this is our patriotic duty. With this out here threatening our economies, threatening our lives, threatening the education of our children, we all have a patriotic duty to do what it takes to defeat it. And in Kentucky, it can grow very quickly. We look at I think this is the Harvard school map that they are putting out, and it just shows how quickly cases can escalate. And when you look just about a month ago in Carroll, Bell, Shelby, and Graves County, you see huge increases that can pop up extremely fast. And so when you ask why we put certain mandates or requirements in across Kentucky, it's that this virus, you can have one case a month ago and 92 cases now, and it happens almost immediately. Our job now is to make sure that no county goes through this and that our Commonwealth doesn't go through what other states are seeing at this moment. Because what we're seeing is states that are now having to significantly roll back their reopenings. New Mexico today announced that they were going to close dining inside. California, I think, just announced multiple rollbacks in their reopening. We do not want to have to do that here in the Commonwealth. So, what do we have to do? Well, what are the actions that we have to take to protect our economy, to the creation or bringing back all of these jobs, to make sure that we protect what Goldman Sachs says is $10 billion of our economy? It is pretty simple. Wear a facial covering. Facial covering helps achieve our 3 goals. Number 1 goal is to protect the lives and the health of Kentuckians. It is now a scientific fact, regardless of where those experts started, they've done the testing. Wearing a mask protects you, makes it less likely you will get the virus. Surely no one wants COVID-19, so wear a mask. If it keeps you from getting the virus, it keeps you from bringing the virus home. It protects your family. It protects my kids when I wear it. It also keeps you from spreading the virus to other people, and that is all of our jobs during this crisis. Second, it continues our restart of our economy. Multiple states now rolling back their reopening. I don't want that to be us. I hope you don't either. And if you are in any of these businesses that are being rolled back in other states, it's more important now than ever that you make people wear masks. So if you're a bar in Northern Kentucky that's objecting to this is the only thing that's going to keep you open. And if we can do this, it makes sure that we don't have to roll back those reopenings that we have recently seen. And finally, I want my 10 and 11-year-old to get back in the classroom. I hope you want your kids and all of our kids to as well. Wearing a mask is the best way to make that happen. But this isn't just me and Dr. Stack here in Kentucky. It is every public health expert all the way up, including the Surgeon General appointed by the President. I think we've got a clip of him talking about how important wearing a mask is and how it could turn this thing around in a positive direction for us in 2 weeks or less.
The disease course is about 2 to 3 weeks. So just as we've seen cases skyrocket, we can turn this thing around in 2 to 3 weeks if we can get a critical mass of people wearing face coverings, practicing at least 6 feet of social distancing, doing the things that we know are effective. And it's important for the American people to understand when we're talking about the fall, we have the ability to turn this around very quickly if people will do the right thing.
So it's pretty clear. All the experts agree. We get a critical mass of people wearing masks, we continue to social distance and we remember it, and we can get pretty close to our old normal. In fact, I think Dr. Gupta this morning even said sports probably depend on people's willingness to wear masks. Now there's noise out there. We live in a culture, especially with what I believe is a broken system of social media, where not only a small group can seem to be the majority, but sometimes because of the amplification that social media can give, they can even lead coverage of it. But today, there was a poll that came out, and here's the question that it asked. These are 2 Kentuckians. Do you support or oppose requiring people to wear a mask in indoor places, such as grocery stores, schools, retail stores, and certain outdoor places, such as mass gatherings? It asked directly, do you support requiring people to wear them in grocery stores or retail, schools, and certain outdoor activities? And folks, it's not even close here in Kentucky. 73% of Kentuckians support that mandate that we have some type of facial covering. And we even use the word mask in here, and some people say, well, facial covering is what you should say because people will think it sounds better. 73%. And it crosses every demographic that you could ask for. It crosses all political parties. There is a majority that supports it. This is what the American people and the people of Kentucky want to see from their neighbors. So remember, when you're wearing a mask, you are a part of an overwhelming percentage of Kentuckians that know that this is what we have got to do. But just think about it for a minute. We wear seatbelts, don't we? And I hope none of us would argue right now that a seatbelt law doesn't infringe on our personal liberty. It protects us when we're in the car. It makes sure that we don't have parents out there that won't put a seatbelt on their kids. It makes sure that we protect human life. But I don't know if you remember, the history of seatbelts had the same arguments we're seeing right now against wearing a mask. Look at this, somebody saying, as long as the life that's risked is my own, I believe that I, the individual, should decide whether or not to use a seatbelt. That sounds kind of familiar. But guess what? This isn't even the same as this virus, because your decision to wear a seatbelt, it might just end up in you dying. Your decision not to wear a mask may result in other people dying. I consider this wearing a mask more like a DUI law, where you say you can't do something where you could potentially harm somebody else, or even driving on the right as opposed to the left side of the road. It's the type of safety regulation that's going to keep us all safe, and guess what? It's not forever. It's just until we have enough people that get this vaccine when it comes out, until we get it in control and maybe can back off of it. It's just until we know that our people are safe. And it's like all these regulations. I don't want to put them in place. We just need to have them until we get through this, we get on the other side, and then we'll get rid of all of them. So we are certainly in a battle, but we are more united, I think, than anyone might have known. But it's sometimes hard to see the reality out there when we're limiting our contacts. So today we continue to see high number of cases. Today we're reporting 277 new cases of COVID-19. That number is down because there is a small number of results that came in today from over the weekend. We expect this number, sadly, to be higher tomorrow. It brings our total number of cases now to 19,653, and 829 of those are probable. The rest are lab confirmed. Our total number of tests, 480,372. And while we are still waiting on our new system that does ICU beds and hospital beds and some of those other data points to get back with enough hospitals reporting, if I gave it to you today, it'd only be about 80-something of 116-ish hospitals. It wouldn't be accurate. We do know from reaching out to them that the good news is while we do have increasing cases, we still are in pretty good shape on our hospital beds, on our ICU beds, and we're in very good shape on our ventilators. But that can change really quickly. But when I give you the bad news, I want to give you the good news too. It's why we're acting early to make sure that stays good news. Our positivity rate as of today on the 7-day rolling average is 4.35%. Now that's up fairly significantly from a couple weeks ago, but I want to put both our total number of tests and our positivity rate in some context, which is fairly good context. So if the numbers from the Kaiser Family Foundation are accurate today, we are 26th in the country in number of tests that we have performed. And of those top 26, we have the lowest positivity rate as of their last recording of it. Again, that's a good thing. But as we see other states get out of control, we got to do what we did before, take aggressive action to make sure that we remain in a better place than our neighbors. And listen, a better place is a better place, but if you have a whole lot more cases, it's still not a place you want to be. So let's continue to do the work that we need to. New cases by county, 78 in Fayette. Hit pretty hard in today's report. 27 in Jefferson, 12 in Davis, 10 in Christian, and then we have a number of other counties that'll be up on our website. We continue to see a rise in cases for children under 5. Today we have 11 children under 5 that have tested positive for COVID, and the vast majority of them are in Fayette County. The youngest one is just 4 months old. So let's remember this impacts our children too. Today we're reporting 4 new deaths to COVID-19. They include a 79-year-old man from Fayette, a 90-year-old woman from Fayette, a 60-year-old man from Fayette, and a 77-year-old man from Warren. We are continuing to see a significant number of 60-year-olds in that range, and I hope none of us think that that is old, that continue to lose their lives to COVID-19. It brings our total number of deaths now up to 629. Let's remember these families. I don't know if I've recently asked everybody to ring those bells at 10 a.m. or to turn on those green lights, but at a time when cases are escalating and we're seeing stuff in Florida that's just terrifying, let's make sure that we're giving everybody else that comfort of them being able to see that green light in their neighborhood and in their community. A couple of extra areas we are now reporting on. Kentucky daycare facilities. Increased numbers since the last time we reported to you, 5 new staff, 2 new children, and this is a very new statistic that we are asking people to provide, and obviously facilities haven't been open that long. We need to keep our daycare facilities open. We need to have this especially for working parents, but we have to know that we need the right rules and regulations in place as more staff and more children become infected. Long-term care. Again, this is since Friday, 25 new residents, 37 new staff have tested positive, 10 new deaths attributable to long-term care, 12 new facilities having at least 1 case. Let's remember our long-term care facilities are one of the reasons that we have to take the major actions that we do. Now I want to ask Dr. Stack to come up to talk a little bit about the trends we're seeing the importance of wearing masks and the steps that we ought to be taking.
Thank you very much, Governor. Good evening, everyone, or good afternoon, everyone. Two announcements for the labs out there. This is an ongoing challenge, not just with the labs, but we give you a lot of data. The governor gives you a lot of data every day. I don't think the average person realizes how much effort people across the country, every state, every day, is exerting, scrambling to get all of this data. It is a lot. It is fast moving. What we get to know about this virus changes on a daily basis. So we rely on a lot of partnerships, and it's a lot of hard work. And remember, the labs, the hospitals, they're all busy providing services too, so they're very busy. But message to the labs, because I know people listen to this, we need every lab every day to fill out the survey so the governor has accurate information to provide for the public. So please make sure you do that. He's mentioned, the governor has, that we switched our data collection process for the hospitals so that he can give you information about ICU and regular bed capacity. The hospitals are doing a great job. We're on day 4 of the transition, and it's 88 out of 113 who have reported. I'm very happy with their transition and committed to getting all of them reporting every day, which fulfills their federal reporting requirements but gives us information we can use to make policy decisions and help guide you. The governor asked me to give you an update about where we are. I'd like to share, he showed a video of Surgeon General Jerome Adams. Regardless of party affiliation, regardless of Democrat, Republican, Jerome I've known for a couple decades, and he's a friend and a colleague. I do regular calls with state health officials from the South and the Southwest of the United States, and I've done calls from time to time with my colleagues up in northern states when our governors were collaborating earlier in this. There's no party, there's no identity in this. It's all about the science and trying to advise what is the best steps we can take as people to keep ourselves safe, minimize the impact of this disease on illness and the loss of human life, and what we can do, like these masks, to get back to life as close as we used to know it as quickly as possible. So Dr. Adams works for a Republican president, I work for a Democratic governor, and there is no space between Dr. Adams and I that it is essential that we use these masks. This disease is one of those things where it takes anywhere from 3 to 4 weeks where you see a lag time. So when people say, well, why are the cases going up but the deaths are going down, it's because the deaths will follow the cases going up by a couple weeks. So there's a lot of detail in this. But we all agree you have to wear masks, you have to socially distance, and we're watching very carefully as societies have, as we've reopened things, what the impact is. Youth athletics is being shown to be a really rapid spreader of this. Every time, not every time, but most of the time the students come back together and play their sports. We found it in football teams and cheerleaders and weight rooms. The thing is, if you get close to people, it spreads. And then people say, well, what about daycare? We need daycare open. Absolutely, we need daycare. But there was a story in New York where an in-home daycare opened up, 16 people infected across multiple families, including 2 grandparents and multiple parents. So we've said the grandparents and some of the parents are particularly vulnerable. So if we think, oh, it's just the kids, they'll be fine, one, they won't all be fine. A very small number are going to have problems. But the older folks and the people with medical problems won't be fine. We know that for a fact. And so how many grandkids will take this home to grandparents, and how many people will be hospitalized, and how many people will die as a result? So then we can talk about bars or restaurants. There's been news coverage for all of those things. So if we want to get back to these activities, folks, we have to use these masks and follow the other guidelines. Sometimes I come up here and I give you data. Sometimes I come up here and I tell you stories. And other times I just try to make some points. Today the point is this. Most of the people that I have encountered have been more grateful that we put in place a requirement to wear masks. Most of the people out there realize we're not up here every day doing this because it's a fun activity. We're doing it because it's serious. And I think what people have lost sight of, and you'll see it, so just follow the news, because it'll happen now in Texas and in Arizona and in Florida and some of these other states. is because none of us had previously been exposed to this virus. When a lot of people get sick in a short period of time, it overruns hospitals. And when we overrun the hospitals, people can't get care for the coronavirus or for other things because there's no space left. We can't allow it to get there. And we showed in Kentucky, we crushed the curve. We kept it flat. For one of the first times in a while, we were one of the best states in the nation because people at home, you, Kentucky, listened to what the governor asked you to do, and you stayed home and you stayed healthy at home. Our curve is going up, and I shared a post on Twitter a couple days ago. It's like when you get on the roller coaster, when you get to the base of that first big curve, and you all know this who have done a roller coaster, you feel that sudden lurch when the chain kicks in. That's where we are right now. We're starting to climb, and the question is, how tall is that first hill? You can impact how tall that first hill is, if it's a little boring hill or if it's a major mountain. So please, it's not too late. Wear these masks and keep that hill small, because that hill means people's lives, and that hill means people being able to get back to business, back to work, and back to the activities they want. You wear these things, 80% or more of us wear these things consistently whenever we're close to each other, we can get this virus under control and get back to activities. It's a small price to pay. It's a simple act of human kindness, and it's medically necessary at this time in history. Thank you, Governor.
Well, not only are we back to a point in time where we're seeing an increase in cases, we're actually back to a point in time where suddenly testing is a little more concerning. What we're seeing is now such a demand across the United States that many of the labs, the national labs out there, are suddenly going back to 6, 7, 8, 9-day turnarounds that we know are severely problematic. I want the people of Kentucky to know we've already taken action and ensure that we have purchased enough kits from here in Kentucky with commitments of 48-hour turnaround from a Kentucky lab to where we are not going to face that issue, at least with the state's testing program. Incredibly important for us to have that stable supply, and I feel good about that supply moving forward, but we still need people to sign up and to make sure you're getting tested. Here is the Kroger sites that are going on this week. They even added 100 extra slots apiece per day. Make sure you get on and see if you can sign up. Northern Kentucky, Louisville, Lexington, and then if we can put up the overall map, no matter where you are in Kentucky, there is an area that you can get tested. Make sure you get tested regularly. I think I got tested last Wednesday. And we'll get tested here again in the near future. It's very important to do. All right, CARES Act funding. We got to announce today another round of helping out our county and city governments. This time it was in Western Kentucky local governments, nearly $2.9 million. This is out of that $300 million pot we have authorized. And of course, we have a duty under the federal government's law that they passed to ensure how it's being used, and so we're handling that system as we get the money out to these cities and counties. It is helping them make sure that they can fight that battle against COVID in your own local community. Finally, got an interesting update today that I think supports the decision we made several weeks ago. We announced that we would be moving Kentucky back to a state-based healthcare exchange in 2022. And if you remember, well, when we did that, we talked about one of the reasons was that the federal government was charging us $9 to $10 million a year to Kentuckians to be a part of that federal exchange. And it was only going to cost us $5 million to completely recreate the state exchange, and then about $2 million a year at most to maintain it. So we were looking even in the first year at a couple $1 million savings and then significant savings later. Well, today we were notified that the federal government is moving the cost from $9.8 million to $15 million, meaning our savings by making this decision and by moving towards it just went up significantly. It means there's an extra of, $5.2 million savings in the first year, so it's now 7.8 to 8.8. and now 12.8 to 13.8 million every additional year thereafter. This is a no-brainer. And we're already getting significant interest, which means I believe we're going to be able to provide Kentuckians more choices at a lower cost. And our hope is that all of this money goes into your premium savings and gives us a more robust, this is a private healthcare market to supplement everything else that is going on out there. So I hope that's good news about what's coming up in the future. All right, we'll move into questions because today we're not even going to go a full hour. We got a number of folks that are here in the rotunda with us, and then I've got a couple questions from folks at home. So we'll go Joe and then Monica and come around.
Details about the outbreak at the Kentucky State Reformatory and the range, what the numbers are there, what steps are being taken to protect the inmates from not spreading further.
The question is, do we have an update or information on an outbreak at the Kentucky State Reformatory? I'll have Michael Brown do that tomorrow. He's been charged with that. I don't have the information in front of me today, and then we can also get you some written information on that. Monica?
And then you said that, of course, health departments are in charge of enforcing masks. Over the weekend, law enforcement, a couple agencies in central Kentucky were putting out notices to let their people know that it's going to be health departments. Can you respond to law enforcement saying that it can't enforce masks?
So it's a little, the question is about primarily some law enforcement groups saying that it's not their job to enforce masks. And that might be some of their position directly, but what each statement said is they will enforce if a person comes into a business without a mask and refuses to leave when they are not served. That law enforcement would come in and directly act in those instances under trespass laws. I think that's pretty powerful. The way that we truly make sure this is enforced is very simple. Our businesses, and these are businesses that by and large asked for this rule, and I think like the clarity of, no shoes, no shirt, no mask, no service. It creates a clear, bright line that each of our businesses needs to be following. And it's not that they have to force a mask on somebody, it's just don't serve them. Don't serve them. You now have the black and white rule that's out there that if you don't provide the service, everybody will wear that mask. And so we're asking local health departments to go to some of our larger retail and groceries just to ensure that that policy is in fact in place. And then I think one of the things that law enforcement was saying is we're not going to write direct fines, but if we've got that person at the grocery store that is absolutely refusing to wear a mask and demands that they be checked out, that law enforcement will respond in those situations. But let's not do that. Let's not be that person making a huge scene in front of everybody else that's trying to do the right thing, that's wearing a mask, and you could be coughing on their food, and then you're at the checkout counter screaming at people saying that you don't have to wear a mask while everybody else does. Don't do that. We don't need to do that. All right, in some states, the governor's virus-related powers have been generally upheld, like Michigan, and others knocked down, like Wisconsin. Why do I believe Kentucky courts keep ruling against my orders in Kentucky? That's an interestingly worded question. The only ruling that's ultimately going to matter is one we need from the Kentucky Supreme Court. I haven't gotten to choose any of these jurisdictions we've been in, but we are going to get this thing up to the Supreme Court. And to me, it's not about the drama of lawsuits, it's about saving lives. Now, the actions we're taking to save lives have spawned lawsuits, so ultimately, do we need a positive ruling on them? Yes. But every day that there's a restraining order in place where no farmer's market has to even force people to wash their hands who are providing you food is a day that's dangerous for the Commonwealth of Kentucky. I mean, every day that an expo center that fits 7,000 people doesn't have a single regulation in effect. I mean, that's a pretty dangerous day. I think we could all agree on that. I mean, let's use a little bit of common sense and realize all these things are temporary. We're just getting through a dangerous time, and once this thing is gone, all those emergency powers go away. I can't wait until I don't have to issue these types of orders. I can't wait until I can just get back to being a proponent for public education and for providing some form of health care to all Kentuckians. That's why I ran. I want to get out there and spend every day creating new jobs. But until we have this virus under control, my job is to continue to do what it takes, and we'll deal with the drama that comes with it. Karen.
To the percentage of Kentuckians, I think you said 22%, you said this is political, I'm not wearing a mask. This weekend, they don't support it. Within that group, there are a lot of them online saying I'm not going to do it. This weekend, the president actually went in public and was photographed. Do you think that is going to help change minds?
The question is about folks online that are claiming that they're not going to wear a mask, and then the president wore one on Saturday. I'm not going to claim it was our mask mandate here in Kentucky, but the president wore a mask on Saturday, and I'm very happy that he did. We have already seen in the annex next to this Capitol folks that had previously not been wearing masks wearing them. The president is, more than any other individual in the country, somebody that at least certain parts of the country look to on behavior. So I think it's a very powerful statement that he's wearing one. I hope he continues to wear one. And if you push all of the noise and everything else out, and that's hard, he's facing an election in November. I believe that simply by him wearing a mask, it saves lives. Daniel.
So, in the past, we've expressed a desire to go into the regions or areas that there's some hotspots and shut them down or get mass testing in those areas. With certain hotspots in the Bill and the trades coming, are you looking into that option to have to either shut down or target testing?
So the question is, are we looking in certain hotspots? We put the map up, and you can put that back up. Are we looking at maybe rolling back some of the reopenings, specifically in those counties? That option is certainly on the table. And if county judges there are interested in it, I want to talk to them as well, and we want to always support that. Right now, we believe that if we can get a critical mass of individuals, even in those counties, wearing masks and engaging in social distancing, that we can turn these numbers around. So my focus right now is on this requirement that we wear facial coverings, and I believe that plus distancing can get us where we need to go, and I want to at least give that a number of days. And it'd take about 10 days for us to see its impact before we take other steps, but I'm committed to doing what it takes to defeat this virus, and if we have to work surgically to address hotspots, we will. And if county judges out there want to take those extra steps, I want to support them. Let me read one, and then we'll go to you, Tom. Is there a place where Kentuckians can report concerns related to the absence of masks? That's to the local health department, and then they can work with us. And it's not just the local health departments. It's also the labor cabinet. It's also ABC, which provides liquor and beer licenses to different establishments. So there will be a number of different groups out there. But I will say I'm really grateful at the response we're seeing. I think it has been overwhelmingly positive. Sure, there are some folks that grumble, but I will tell you it's really positive if folks are grumbling but still wearing it. I think when you look around and you see so many other people wearing it, you say, okay, if I have to go through it, everybody else is going through it too, but this is our chance. And we had one of the cable news doctors on today saying we could potentially have fans in the stands in major sports if we can get that critical mass wearing masks. That seems like a pretty good deal, I think, to most people that are out there. Tom.
Thank you. The State Court of Appeals has declined to overturn the lower court decisions, which of course they combined two cases, and we're not going into all of that. How quickly before you're going to check to see if the Supreme Court will take it up directly?
So what the Court of Appeals today did is a single judge decided that he wasn't going to stop the restraining order that is out there. But then the process is it goes to three judges that then actually consider all the arguments. We're likely to move directly to the Supreme Court and ask the Supreme Court to go ahead and hear as much of this as they can. I think we need legal certainty, and I hope everybody out there says, sure, let's get it in front of the Supreme Court to get a final ruling and not do this back and forth for however many days. And that I hope everybody agrees that if a governor has the power to do this and we need to be doing it, that we shouldn't be holding it up in lower courts. Let's just get that final decision. I'm not in this to win court cases. I'm in this to save lives. WHAS, families of inmates at Kentucky State Prisons say without more widespread and frequent COVID-19 testing, they're left in the dark about the health of their loved ones. ACLU has called on the Department of Corrections to test 100% of people that are in their custody. Will that be a reality? Where we believe that we have outbreaks, we are committed to significant and widespread testing. We still don't have any cases or any signs of any cases in a number of our institutions. It's the same approach we are taking to virtually every other type of facility outside of our nursing homes, which the numbers show how hard they've been hit. But we are committing where there is danger to do significant and real testing. In fact, while we have no jurisdiction over it, we spent days or even weeks pushing the federal government to do more testing in the federal prison in Lexington, where we saw a significant outbreak.
We're going to talk a little bit about the mask mandate and his part and the challenge against that mandate. And I want to kind of ask you two questions. One, what is your general take on the challenge to the mask mandate and the question over constitutionality? And two, what do you make of their discussions about how, or their point rather, that if there was more collaboration between your office and his office and the legislative leaders, that some of these challenges may be avoided?
Well, it's a two-part question. The first is, what do I think of the current Attorney General's challenge on the mask mandate? You can't have it both ways. You can't say that you're not against the mask mandate and then challenge it. And I would just say, I challenged the last governor, but we were never in a worldwide health pandemic where the challenge was over a facial covering that could save lives, $10 billion of our economy, and be the key to reopening schools. Every case we filed, sure, there were consequences for it, but I filed a case when the governor had illegally cut our universities and community colleges. I'd like to think that this is a whole lot different in a very different time. Second piece is apparently there are comments being made if I'd only consult their office and consult legislative leaders. That's not in the law. It's just not in the law. And I don't mean to make them feel left out, but I got limited amount of time during the day, and I'm talking to public health officials, I'm talking to other governors. But this concept that we're not talking to legislators or others is false. Legislators write letters and call to different parts of our administration virtually every day. We had a Republican legislator from Louisville that sent a big long text about sand volleyball courts and pretty upset that they weren't open. Now, I didn't know that they were closed, but even something of that level, right, is making it up to us and then we're responding to it. Now, just because they're not on a telephone call with me doesn't mean they're not talking. I think we saw testimony from our agriculture commissioner that I haven't responded to a letter from him. He had an hour-long conversation with Dr. Stack on the letter. I'd hope that's sufficient. I would hope if you're asked a question about a response that you'd say it. So, the public's not getting all the information, but if I go out and try to correct the record every day, I'm caught up in the drama, and I'm not fighting COVID, I'm fighting other people. I'm gonna fight COVID. Joe.
According to the New York Times tracking different states' level of testing, it shows that Kentucky's has actually gone down recently, and it's at about 43% of the target of what we want testing per capita. Is there any reason why that testing number's gone down, and are you concerned that you're not able to increase it further as cases go up?
Let's ask Dr. Stack about that.
So the question from Joe is public reporting that our testing numbers have gone down, the number of new patients tested. That goes back to my first announcement, the difficulty of just getting the information. So I know what we do with our contracted lab to support Kroger drive-thrus, local health departments, hospitals, and I know that when we are in the middle of the week at peak, we're running 3,500 to 5,000 tests a day. And 5,000 tests a day puts us comfortably at the 2% or more for the state. So I know we're hitting our targets for what we need to do for the state. The challenge is it's hard to get the data from all of these other labs. Some of them are out of state, some of them are in state, but they do a lot of testing for other states in addition to Kentucky. So it's difficult to get this information because we have to solicit it from them every day individually. There was no system in place to report the number of people tested. The law requires they have to report the number of people positive. We're working on that, but we're designing a whole new system for a disease unlike the way we've handled any previous disease in living memory, so it's been very difficult, and every state is facing this same challenge.
I think the fact that we are identifying that we are increasing at the time that we are, we do have significant testing out there. Do I always want more? Sure. Last week, the Louisville and Lexington Kroger sites, and there are a lot more sites, but these are just the ones that we think about the most, were booked. The Madisonville one had 300 plus openings to serve a region where so many counties can get to it. Now, I know the county judge down there is committed. I know he's working, but we also need people's buy-in. We can provide the testing, but we need people to get out and do it. I was very worried about the appetite for testing, what I was seeing up until before the 4th of July. 5th of July, I think people woke up and are really concerned, and that next day we had people walking up to testing sites in certain areas wanting to get a test. I hope that that type of buy-in continues. All right, working on a story about Catholic schools reopening this August. The Archdiocese of Louisville says they won't require masks of students and teachers when social distancing is possible. That's our same rule, that if you can spread the desks out 6 feet, you don't have to wear it when you're sitting at the desk. But every time that it's not possible, you pull that mask up in the hallway. And if a school says they can't get the desks 6 feet apart, got to wear that mask. It's the only way that we can get a school open and keep it open. And if you think it can't spring up real fast, these sports teams that are just practicing in the summer and how quickly you'll see 1 or 2 cases in the shutdown of it shows how we got to get this right. Monica.
Question for Dr. Stack. It's about testing and just the different types of testing, whether rapid testing is still good or if they should be signing up for these other types. Just kind of going back. I know it's been a couple months since people have heard about these different types of testing.
Thank you, and thank you, Governor. There's 3 different types of test. The most reliable and accurate to determine if you're currently infected is a PCR test. They swab your nose, either the back part or the lower part. Sometimes we're going to get to a point you can spit the saliva into a tube. There's reasons why that hasn't taken off yet, but I bet we'll get there in the months ahead. Second type is an antigen test. This tests for proteins. You do this when you go get a rapid strep test at an urgent treatment center. There was only 1 approved by the FDA, now there's 2. The first one's the only one that's readily available yet because the second one is just kind of ramping up. One of them is pretty good. I don't know the details of the other one yet. The third one is an antibody or serology test. This is the one I have been consistent in telling people, do not go seek these just yet. Only get that if a doctor who knows what they're doing recommends you get an antibody test, because there are a lot of them out there. The quality is highly variable. You can't rely on what it means if you just get one of these that's either a low quality test or someone who doesn't know what they're doing. So don't waste your money on those unless you have seen a properly trained physician who has recommended there's a reason for you to get it. Thanks.
Karen?
Of the number of complaints that did come in over the weekend, or any fines went out, you know that?
I don't have that data yet. What we have primarily received is really positive information about the numbers of people wearing masks. Now, in areas where there was already a decent number of people wearing masks, you see a whole lot of them. In others, I think we have doubled or tripled the number, and it'll come with a little bit of time. I don't think there's any question that even 5 o'clock last Friday, we saw Kentuckians by and large step up and do it. What that 3% number tells me is people are very willing to do this and support it, but they wanted to see everybody else do it too. Daniel.
With the kind of testing that respect, positivity, as we look at the 2 marketplaces that we're going up to, do you feel comfortable with where the state goes entities where the mask kick in and rather than a hotspot or clusters of things, activities that we're seeing that you're really worried about?
The question is, with the positivity rate that's gone up, with some of with us, we would like more testing, but we think there's more testing out there than the numbers show. Am I worried about the next 10 days? And what we'll see, yes, though our escalation isn't near what some other states have been. And it's not picking on other states, but numbers are numbers and places are places. What we've seen in Tennessee the last couple of days is concerning. What we see in New Mexico, certainly what we see in Arizona. Arizona's terrifying. I mean, they are so close to our size. It's terrifying. So we're going to watch very, very carefully. As long as we can stay in a range, I believe that we're going to have time in the next 10 days. We still have a significant number of hospital beds, ICUs, and ventilators, so we're not worried about the amount of care that's going to be there for people. But we can't slowly walk in to wearing facial coverings. We got to put them on and wear them. On hotspots, we're still watching and wanting to make sure that if we have a major area, and listen, Lexington's getting hit, Fayette County, we continue to see really rising cases. And then what we'll see in eastern or in western Kentucky is it's no longer, it used to be a nursing home, right, would have an outbreak. Now it's somebody goes on vacation to a beach and comes back. They go to work on Monday or Tuesday. They go to church on Sunday. And by the time they find out they got it on vacation, it's throughout the community. So one thing we're going to have to think about is if Kentuckians won't stop saying, no, I'm not going to go to a beach in Florida where there were 15,000 new cases in a day, we might have to urge them a little bit more not to do that. Tom?
Question two, sorry to keep jumping back and forth. I believe I heard you say at the committee meeting today that there's more evidence that the virus is able to live in the air longer than originally thought. Can you talk about that a little bit, sir?
Thank you. So the question is about the virus living in the air. So the primary way the virus spreads is when I take off my mask and I talk. It's kind of gross if you think about it. If you watch someone with a high-resolution camera, you can see the spray that comes out of our mouth. That's the most common way, hands down, that we spread the infection, is spraying onto someone else who's close to us, and it gets in their eye, their nose, their mouth, all of which are portals into our respiratory system, and then you get infected. But there are some infections, and measles is one of these, that when you talk, there are smaller particles that you put in the air, and they can stay suspended in the air for an extended period of time. And when you do that, that means you could walk through a cloud of it or a room that was small with a high concentration in the air and just breathe in the air and get infected. Now, measles is much more powerful in that regard than the coronavirus, but there is evidence and there is concern, and that's where people saw news coverage, a couple hundred, I think, science experts wrote to the World Health Organization commenting about aerosol particles, which are really tiny. And so that's why we tell you do things outdoors instead of indoors whenever possible, and try to avoid staying in small rooms for extended periods of time with other people, even with a mask. So you are better off to be socially distanced, meaning fewer people in the same space, and doing things outside where the air circulation is much larger to reduce the risk of that spread. And cloth face coverings are not as good for preventing you from inhaling aerosolized particles. They're not high quality enough, but they still help a bit. It still reduces some of the concentration. So we think there's some benefit if you wear a cloth face covering, even to protect yourself a bit.
Okay.
Gonna ask my question. I know you said in the past that the decision to roll back the reopening would be based on hospital capacity, ICU beds, that sort of thing. Is that still true, and how close do you feel like we're to that point where we might need to start rolling some stuff?
The question is on the different things that we're looking at if we were going to determine anything to roll back and when we would do it. It's a mixture of total number of cases, the positivity rate, which gets you beyond just the number, and the space in our hospital beds, our ICUs. And then I think it's fair to say, and Daniel asked this question, if there are specific areas that we start to see a significantly high level of spread in. For instance, if our high school or youth practices all of a sudden on a statewide level were of a major significant spread, but it wasn't necessarily impacting overall numbers, we'd want to react to that. There's no perfect science, there's no rule book on how to do this, but we look at all of those as objective data. Folks, I wish that we could turn this camera around. I want to again commend the media and everybody who works in this building. We got one of our legislators here too. Everybody is wearing a mask. We appreciate the example that everybody is setting. Let's make sure we continue to do our best each and every day. The next 2 weeks, the next 30 days are critical. I know I said that in the past. And guess what? We did a really great job during that period. But our battle with this virus isn't over, and it doesn't care if we get tired. So now's the time to, I think my dad would have said, suck it up. Do what is required, wear that mask, engage in social distancing. We can, we will, and we must win. Thank you all.